My name is Jennifer Bossio, and this is a training video based off of my internship. I just completed an internship at Access OC, which is a nonprofit organization, and my main duties were to work on an eConsult seminar. But what I wanted to train in my video today is about eConsult itself, which is a software system. So this training video is going to look at what eConsult is, kind of how it is facilitated within the organization, how it's overseen, how recruitment works, and then a little bit about how I want to proceed now that this internship is completed. So first, what is eConsult? eConsult is an email system. So basically it puts the primary care doctor in touch with specialists on behalf of the patient. And this is really helpful for the underserved or the folks that would be part of the Access OC organization. So how this works is a primary care physician, they have a login, so they log in, and if they had a patient, we'll just say patient Smith had a stomach condition, and he was concerned that this might be serious and he might need to see a gastroenterologist. But that's very expensive to see a specialist, as well as if you don't have insurance or you're not able to pay the full price to go see a specialist, you get put on really long waiting lists, or maybe you might not even see a gastroenterologist at all. So this software has been designed so that this primary care doctor can, write in on their email, Mr. Smith, he has abdominal pain, so it puts all the symptoms. If he needed to take pictures or if he's done lab work, he can upload all this onto the system. Then it gets inputted into a queue, and then on the opposite side, the gastroenterologist comes on and they log in and they see Mr. Smith, so-and-so. They go in, and once they've done that, they have basically said that they are going to take this. It's like a curbside consult. So they've agreed to do this. So they go on, and they're going to look at all the information, and they can talk back and forth with the primary care physician. Now, if the primary care physician hasn't uploaded all the right information, then he can continue to do that. And so then this gastroenterologist looks at it, and he can make the decision of, okay, well, he really doesn't need to see, he doesn't need to see a gastroenterologist. He really just needs, X, Y, Z, and the primary care physician can take care of that. So we've eliminated even the need to see a specialist and wait all of that time, and kind of, the whole process has been sped up for the patients. And then on the flip side, if they do need to see a specialist, the gastroenterologist can tell them, well, you don't have all the right work, we need a complete blood workup, and we need all these things so that when they do get to see a specialist, they have all the right information, so it doesn't take longer to see them. And also, it generally tends to put them quicker into the queue so that these patients can be seen quicker. So that's the idea of eConsult. Now, within the Access OC organization, this is all done without paying the doctor. So this is all considered volunteer work, which makes it a bit challenging to recruit as well as to facilitate. So Access OC's role is to recruit physicians, which is done either through email. They attend a lot of specialty meetings. The executive director is on many of the boards. So, that's how they recruit these physicians, and they explain the software system. This is the greatest thing about eConsult, is it's not only free to all aspects of the who are inside of this loop. It's free to everyone, as well as it's all HIPAA compliant, which is amazing. And as far as some of the challenges of implementing it, besides the fact that no one gets paid to do it, it's also, there is a small liability, but most hospitals have went ahead and their general liability covers this, since it's considered a curbside consult. So it's a great tool. And right now they have Access OC currently has 20 specialty physicians on board, and I think it's around a dozen or two clinics that are using this already, and we're getting more and more primary care physicians kind of signed up. The challenge is getting the specialty care. You know, the primary care is easy because it's for their side. This is helping their patients. For the specialists, this is volunteer work that they do above and beyond their normal everyday expectations. As well as for the care coordinator from Access OC, they go on daily and check to see how many consults are on there, and they notify the specialist when there's a need for them, so that they're not having to go on every day and look for consults, because sometimes there are none. You know, they might go through a month and there's only 3, and then some months there might be 10. So it kind of eliminates for both sides and kind of speeds up the process. So that's the eConsult software, and it's where it's penetrating so far within Orange County. For me, since I am finishing my internship, I have volunteered to stay on within the organization. My eventual career goals, I would like to get into healthcare technology or potentially a consulting firm.